Speaking on his show on LBC, Nick Ferrari ridiculed the idea that the NHS is facing the biggest crisis ever while £13 billion sit in a fund that's providing contraceptive clinics in Malawi, the radio broadcaster said. It is insane to think that thousands of non-critical surgeries will be cancelled in January to cope with the lack of labour and funds after the busy Christmas period, he said. The NHS is getting £3 billion a week, but I don't think that all the money that's going into it's particularly well spent. I think it could be managed far better. LBC GETTYThe NHS faces an unprecedented crisis while government keeps foiling aid fund. We have £13 billion sitting in a fund that's providing contraceptive clinics in Malawi, but we haven't got enough to look after patients in Stoke. Nick Ferrari, but to get us out of this crisis, because this is unprecedented, this has never been on this level before, the whole of this month non-critical operations are stopped, tens of thousands operations cancelled, patients to be put on mixed wards. I don't number why that makes the headlines. Senior doctors will be at the doors of air units up and down England to turn away non-urgent cases. This is fairly grim stuff, but again, we have £13 billion sitting in a fund that's providing contraceptive clinics in Malawi, but we haven't got enough to look after patients in Stoke. Am I the only one? This is completely insane. In an attempt to try to free up hospital staff and beds, the NHS urged hospitals to defer day case procedures and routine outpatient appointments until January 31st. Officials have estimated that this could lead up to 55,000 deferred operations. Cancer operations and time-critical procedures should go ahead as planned, NHS England said. In a statement, NHS said that the panel discussed sustained pressure over the Christmas period with high levels of respiratory illness, high bed occupancy levels, signs of increased flu activity and a rise in the number of severe cases attending AIR. Thursday, February 9, 2017. Sir Bruce, NHS England National Medical Director, said, I want to thank NHS staff who have worked incredibly hard under sustained pressure to take care of patients over the Christmas. We expect these pressures to continue and there are early signs of increased flu prevalence. The NHS needs to take further action to increase capacity and minimize disruptive last-minute cancellations. That is why we are making these further recommendations. A DFID spokesman said, we do not face a stark choice between spending on international development or British healthcare. This government is able to do both. Our aid investments do not direct any resources away from the NHS. UK aid is tackling the root causes of global challenges such as disease, mass migration and terrorism that know no borders, and this is making Britain safer, which is firmly in our interests.